The pandemic is behind us, or so it would seem. Now, a lot of us have got our vaccines, are ready to get back to life, but for some of us, the answers are not so simple. You are watching Science, Health, and Healing with Dr. Majid Ali, and we are here in Studio 1 of MNN, and we're very pleased to have you, Dr. Ali, back in our studios again.
Thank you.
It's very good to see you back here. I got my vaccination. I got the Moderna. I believe you got the Pfizer, and we have a director tonight who has gotten the AstraZeneca. How do you stack up those three vaccines?
I think out of that, the best track record in the general public is actually Pfizer. Moderna has created the most problems.
Really?
I'm just speaking about my direct experience with the people who had Moderna. Moderna people had not only local symptoms, but they would have sometimes fever. Some of them had enlarged lymph nodes in the underarm. And that would sometimes last for 2 weeks, 3 weeks. And then there is a fear associated with it. So even though I have not personally seen that lymph node enlargement in the underarms and in the neck to create serious, chronic, persistent disease there, lymphadenopathy. But it seems to have unexpected consequences in terms of anxiety it produces in general public. So the people who did, some of them did have some...
Is that psychosomatic, something they've heard on in the media, or is that, is it in terms of rumor, or does the actual injection give somebody anxiety?
I think, Richard, it is deeper. That one day when India lost 1 million people in one day, we have 3 doctors in our group from India. And they have their parents and their family. So this was a great national disaster for them. So then when they felt lymph nodes and they had fever, they knew that these are constitutional symptoms of virus, which means now virus is spreading beyond the area of original invasion, which could have been throat, for example. So I think that can leads to anxiety. And then anxiety under these circumstances, even if they had a slight malaise or if they had a slight little bit of a mild fever, that gets blown out of proportion.
Well, speaking of blown out of proportion now, I got COVID in December. I spent a month in quarantine. Then I got shots, my 2 shots, and I experienced virtually no symptoms. But every time I get an ache in my foot, every time I have a little brain lapse and I can't remember an actor's name, everything that happens to me, I want to blame. I say, oh, it's that damn COVID. And these are probably things that would happen to me anyway because I'm not a teenager anymore. But I'm wondering, is that COVID? And I'll probably wonder that for the rest of my life. There's probably no way of answering that question, correct?
No, I don't. I don't think I would like to go rest of my life. I think this is where deep knowledge of this thing, ongoing study of this, ongoing study of the patients who are sick, ongoing review of the literature, and certainly this pandemic has been covered to a depth which to me has been unanticipated. Every week, my copy of Journal Nature carries 20, 30 articles on this. And they discuss the material. The editorial board of the Journal Nature is probably the most qualified, the most demanded in the entire fields of surgery science. So as I read them, I'm very impressed by the depth of the understanding, the writers. And of course, most of those writers are experts in their particular area. Okay, not for the whole pandemic, but they are experts in their area.
So I was going to ask you about this, but first of all, what have you learned from this past pandemic? I know we had a conversation in February of 2000, a couple of weeks before the shutdown, and you were speaking about a book that you'd written about the 1918 pandemic, and you successfully predicted. I know you're not a psychic, but you told me a lot of things that would happen over the next 6 months and next year, which shocked me at the time, and then I was even more shocked when they happened. So what have you learned from this past year, this past pandemic, that you did not know before March or February of last year?
In the large book of Alcoholics Anonymous, there is, somebody sent me a small quote.
Right.
And it said, the darkest times become our strongest strengths. And I thought that for Alcoholics Anonymous to put this quote, this sense here.
Right.
What I think they meant was that in the depths of despair of addiction to alcohol, right, usually there is also, I should say very often, there is substance abuse in that. And there are, in the history of these people, attempts to end their lives, and the broken marriages, and the right, broken families, etc. So how would that become the strongest possession? Only because out of that deep sense of despair and helplessness, right, comes an inner signal from someplace, okay, that I have to go on. And maybe among my family and my friends, some people are weaker than I am. So maybe I have to find strength not only for myself, but also for them. So I thought it was very relevant, and I am going to use this quotation from Alcoholics Anonymous in my book. Richard, when I think about the roles we physicians played so far in this, I read it and then I try to write it with suffocating shame. Suffocating shame. That we know so much about viruses. We know they're constantly mutating. Okay? We know that these viruses have a tendency, they have a capacity to sense where the weakness is in their target person. Right. Okay, and that has been worked out for a very long time. And that is, number one, when the tissues are low in oxygen, that fact builds to build-up of acids. Now, these are the two conditions that coronaviruses, all flu viruses, they go for it. So nature has given them a capacity to sense which part of the body is favorable for their survival and their proliferation and their growth. Because viruses are concerned about their own domains and about their own survival. We also have some defenses against them. We, with very simple things, can keep our oxygen levels up. We, with very simple things, without needing these ventilators, where the mortality has been up to 90%. Right. Okay. Now.
And we only have 2 minutes left, so I'm going to ask you to give our viewers advice on how they can protect themselves from this virus, future viruses, and any variants that will come up.
The simplest thing, Richard, is they have to visualize a time when they were in a place of worship last time. It could have been a temple, it could have been mosque, it could have been Gurdwara for the, for Sikhs, etc. The places of worship have their own etiquettes. And those etiquettes is sense of camaraderie to the family around them, friends about that. That's number one. A sense of a larger presence there, which could be in the scriptures, which could be in the words of the speaker, or they are talking, or their children are sharing glances with each other. They know they cannot shout, "Hi, Susie, no, David," no, they don't do that. They acknowledge each other with their silent eyes, because both groups know we are in a place of worship, and then our family is around it. Those are the conditions where automatically the muscles are not tight, the gut is not in knots, and the oxygen is coming in, and there is enough time for oxygen to leave the lungs, they get into the blood, and then be circulated throughout the body. Now, oxygen, one of the primary functions of oxygen is to not let the acids get built up in the body. Because buildup of the oxygen acids compromises health in many ways. And so the simplest thing that I ask people is working, walking, worship. When you leave a place of worship, imagine, do a thought experiment. Imagine that you're walking towards to your home or to your place of work, but you, in your imagination, you are in the same place of worship, and you have the same physiology, the state of physiology at the place of worship. And that happens to be no tension in the neck, no spasm in the muscles, no cramps in the belly, and then you're not hyperventilated. And usually in place of worship, people have less anxiety. So this simple thing. Now the other thing that we used, we advise our patients it.
And very quickly now, because we have to wrap. So
I call them peroxide packs. You take paper towel, you wrap it around leg or your thighs, wherever, and then you have hydrogen peroxide, 15 parts, 3% hydrogen peroxide, and then you take 1 part, I misspoke, 15 parts of water and 1 part hydrogen peroxide. No, you pour it on the paper towel that you made a wrapper and soak it. Then you throw some Epsom salt on it. Or if you don't have Epsom salt, ordinary table salt. Now, after that, go back to the physiology of the state of worship, the state of compassion, the state of, there are all of those things. It's a state that I am interested in.
Now, state of mind.
Well, yes, state of the body also.
Yes.
Okay? Because we may use state of the mind to enter a state of the body. But the 2 attributes that we are looking for, which is relatively high oxygen and relatively low acid. Those are 2 so simple things. This knowledge alone is enough. When people go to emergency room with hyperventilation syndrome or they have anxiety, what do? We assure them and check their pulse and the blood pressure, and then we give them a brown bag, paper bag to breathe into that. So for the patient, he's in emergency room, there are nurses there, there are doctors there, and they are reassured him. Because if you are offering somebody a brown paper of bag to breathe in, this means this is not ventilator. This is not a lung machine. Yes. So, and you're surrounded by people who are caring. And that total effect that I am in good hands, these people care for me. Okay? Those simple things are what, rather than allowed to slide deeper into anxiety and then panic is hyperventilation, okay? So rather than go into that direction, you change the direction, and this is a direction of calmness, tranquility, peace. And then a reminder that we are in the presence of a larger presence,